people. Madeline, do you want me to do that?
Yes, please.
Hello. Hey, Madeline.
Hi, BJ. Hi, everyone.
Hello, everybody. Didn't think I could make it today, but was able to.
Fantastic.
Hi, everyone. Glad to see such a great turnout.
Hello.
This is only option one people, right?
Yeah.
The,
Yeah.
the eager go-getters.
What it means is that we are going to have hopefully just as many people on the next one too. So we have a really, really great, robust group, and it's only going to get better.
You know it.
Okay. All right. This is fantastic. We have 32 people on the line, and we are so thrilled to be here. We are so thrilled that you all are taking the time to participate in the IDD Advocate Corps and to learn more about it. There have been a group of us, the advisory group, who have been working on developing this for almost a year, a little over a year. And so to finally see it kick off, it's just so amazing. And to see such interest and passion among everybody who wants to join this movement, we are just so thrilled and so grateful. So let's go ahead and get started. So my name is Elyse Pegler, and I am a volunteer co-lead of the IDD Advocate Corps. I'm going to kind of kick us off, and then I have a wonderful partner in crime, Yolanda, who's going to co-present. And together we're going to help bring you all into this movement and get everybody up to speed on what this is and what you signed up for. So let's go ahead to the first slide, which is welcome and introductions. So as we said, we've got now 34 people on this call. We have another 25 or so who are going to participate in the kickoff call on Thursday. So this is a fantastic turnout, and again, what a great way to start this brand new initiative. So one of the things, and we're going to talk about this more, that is one of our key objectives is building a nourishing community. And so part of that is that we all want to get to know each other. Now, we also know that we have an hour and a ton of content to cover. So we would love if people feel comfortable putting in the chat your name, where you live, any identities you'd like to share, self-advocate, clinician, and so forth, and a fun fact about yourself. So I'll go first. Elyse Pegler. I live in Rockville, Maryland, right outside of DC. I am a healthcare professional working in the insurance industry, but I've worked in government and with providers and all sorts of different capacities over my career, and that's my day job. But my most important job is being a mom to two neurodiverse kiddos, and they are my passion and my fun and everything that I do.
How do you
All right. So Yolanda, do you want to just quickly do the same thing verbally, and then
Hi. My name is Yolanda Vargas. Pronoun she, her, hers. I'm a self-advocate, and my brother Trevor also has Down syndrome. And I'm just really passionate about changing the future of healthcare. And if y'all are here, so are you. So glad to have everyone.
Awesome. All right, great. And I see people putting in the chat. Fantastic. And if there are any challenges with the chat, let us know. And that's one of my fabulous kiddos. So crashing the call, which is pretty par for the course. Okay, so and if you have questions, raise your hand or use the chat. We do have our IDD advocate, our IEC team, which is the Institute for Exceptional Care, who's sponsoring this amazing effort. And they are assigned, both Nicole and Madeline are assigned to Lauren and Madeline are assigned to addressing any sort of issues that come up, or if people have trouble with the chat, we're happy to help troubleshoot. All right, let's go to the next slide. All right, so as I mentioned, the Institute for Exceptional Care is a national nonprofit that is working on making healthcare better and safer for people with intellectual and or developmental disabilities, IDD. So going forward in the whole presentation, we are going to use the phrase IDD, and that encompasses all sorts of neurodiverse conditions and identities. And so autism, ADHD, Down syndrome, so many others. And what the mission of both IEC and what we're doing within specifically the IDD Advocate Corps is to change healthcare for people with IDD, because healthcare is confusing for everybody, but it is particularly challenging for people with IDD. And so that's really our mission. We have fantastic funding from the WITH Foundation, and we are always on the lookout for additional funding as we go. All right, let's go to the next slide. So the agenda today, we're going to talk about our group norms and expectations. We like to start every call this way because we want to set the tone for all of the work that we have coming up and every meeting to really ensure that we are all working in the same manner, in the same way together. We're also going to give an overview of the IDD Advocate Corps. So we're going to talk about our values, our plan, and our advocacy model. And then we'll give a little bit of information about the structure. So how we're going to do the work, how we're going to affect all of this change that we're talking about. And then we'll talk about timelines and next steps, because we always want to make sure at the end of the meeting that everybody knows what are those concrete things that we need to do next. All right, let's go to the next slide. Okay, so these are our meeting values and guidelines. So again, Yolanda's going to talk about
takes forever.
our group guideline, our IDD Advocate Corps mission and values, but we again want to model for everybody that the perspectives of people with IDD are primary. And we also want to model that we speak slowly and clearly in plain language. So again, if we have acronyms, first of all, we try to minimize them, but if we do have them, we try to explain them. And the number 8, which says no questions are silly, should actually be really number 1 here, because if you do have a question, if somebody's using jargon or abbreviations, pop it into the chat. Nothing is out of bounds. We really want, again, everybody to feel comfortable and can absorb the information in the way that works best for them. And so sometimes that might be chat, sometimes it might be talking on the call, sometimes it might be taking the time to process and think about it afterwards, and then responding to us over email or whatever works for you. we always want to do that where we give people the time to think and answer. And we'll often do pauses and make sure that everyone is kind of with us. And then we just also want to make sure that everybody appreciates and listens to opinions and perspectives. So, as Yolanda said, we are all here for the same reason, which is because we're passionate about changing healthcare for people with IDD. But within that, there might be differences of opinion about what's the best way to do that. And that is okay. And it's encouraged. And again, all communication preferences are welcome. Some people like to just read what's on the slide. Some people like to listen to what's on the slide. Some people want to contribute via talking or via chat. So we welcome everything. All right, let's go to the next slide. Okay, so I am going to hand it over to Yolanda. I think you may be on mute there.
Yes. Oh, sorry about that. Perfect timing. I was just getting off of public transportation. Sorry about that. But yeah, so just to touch base, we're all here for the same reason. And I think a lot of organizations have tried to do what IEC does, but what makes us special is the way that we are focused on collaboration and uplifting those that have lived experience to connect them with important decision makers and people that inform the systems of healthcare that most greatly impact those with intellectual and developmental disabilities. So here on the screen, we kind of have an overview of, our guiding principle and why that's so important to us. And really what you all will hopefully be a part of. Okay. For some reason, it's not showing me the slides. It's just showing me your lovely faces, which isn't to say that I don't enjoy seeing them, but being able to see the slides would be greater in this particular moment. Let me just pull them up on another part of my phone. Boop, boop, be doop. Bear with me. Okay, and so that we believe healthcare works best when it values dignity and validation of every person. So we are very person-centered. I think oftentimes everyone can stand to listen a bit more in any situation, but especially when it comes to healthcare, there has been a history of people with IDD unfortunately being silenced. And of course, we've come a long way from those sadder, more tragic days. And we're just making sure that nobody's kind of left behind or forgotten or silenced again as we move forward into the future. And a big part of that is self-determination and tailored decision making. We truly believe that everybody has a right to participate in their healthcare. And it's totally fine that some people may need additional support. I mean, who here amongst us hasn't been in a medical situation where maybe they had to rely on somebody? I mean, that's a major part of healthcare, is making sure that you have a team with you that understands and respects your needs and your realities. So we're really trying to bring that to the forefront of change when we are focusing on the IDD community. And then person-centered care delivery is so important. And this is one of the major components where we're trying to bridge the gap between physicians and patients to make sure that, doctors and other care specialists have what they need to provide the best care possible. We understand that there are gaps in education and knowledge, and that everyone is human. And I think by opening these dialogues, and having our advocate core team be a asset and a resource to medical professionals, we can kind of start to heal the wounds and help everybody strengthen their skill set. Because in the end, you know, nothing about us without us is so tantamount to the IDD community. So first we have our plan of action where, you know, we identify change agents and allies and champions and collaborators and bring those people together and equip our advocates, you know, with the resources and materials and training that they need. We co-develop our vision with advocates. Every single thing that I've been a part of with the IEC has included advocates along the way, and they've been in positions of influence and have never been filtered or made to feel tokenized. And it's just a beautiful experience. So for all of the self-advocates that are on this call, if you've ever had anything where you've been treated less than, I can guarantee you that they absolutely will do their best to make everyone feel included and appreciated for the hard work and insights that we provide. And then we co-design those actions, making sure that individuals and organizations in healthcare understand what exactly they need to do to be better. You know, it's not just finger wagging. It's, hey, we brought all of these people together. Here's a plan. Collaborate with us. And self-advocates are always at the core of what we do. And going forward, they are at the front of that. And they are kind of the heart of the organization. And once we have concrete steps to take and resources created, that's where we disseminate. We do not just put out information without input from self-advocates. So next, and please let me know if I'm going a bit too fast. We just do have so much wonderful information to get through today. So next up, we have...
She got part of it removed.
Okay, was that a question or did somebody just come off mute? I don't want to cut anyone off. Okay, so example of impact at scale. Here's some of the things that we would want to have input in and maybe help, you know, clear up. So it's the first example, emergency rooms are overwhelming for people with IDD. Doctors lack knowledge to manage. So a clinician in the IDD Advocate Corps worked within their hospital to design a sensory-friendly, quiet room for patients. It was so successful that a protocol was established and spread throughout the hospital system. And then so they would share their learnings with other IDD Advocate Corps members, you know, and then hopefully that becomes a standard throughout healthcare systems. That sensory sensitive practices are put in place in other overwhelming situations, such as the emergency room in the initial part of the example. And those are kind of just one example of how we hope to shape healthcare in a way that is more accessible and equitable for those with intellectual and developmental disabilities. Okay, and then the next will be a highlighting of our grassroots advocacy model. And I just really want to touch on another thing that makes us so unique is that we truly want to hear from everyone. There is no gatekeeping, no base level of degree, no 20 years of experience. Everyone here has something that they can contribute that is valuable and amazing and unique to them. And that's why we're so excited to host all of you all in this endeavor. So, number one, nourishing our community, making us so accessible to you all in a myriad of ways so that, the whole of we hope to get all of the states involved. We're currently growing our list of collaborators, but I would love to see IEC take over the world, but in the best possible way. That seems so ominous if we take over the world, but you know what I mean? Just, spreading our benevolent influence. Just, helping people make healthcare better for everybody. Who doesn't love that goal? Resources, so we would hopefully, be able to provide you advocacy training and toolkits and fact sheets and presentations and best practice sharing. Like, I think that's such a wonderful core of the advocate core, is realizing people want to do things differently. We're just helping show them how. And then healthcare sector specific work groups, so that we're working smarter, not harder, and making sure that people have the best skill set and the most passion for certain things are where they need to be, working specifically on their target issues. And then finally, accessibility, making plain language materials and group norms is so amazing, because we have so many self-advocates and so many people with different experiences that we're abundant in resources as to being able to tap people and be like, hey, is this accessible to you? Would this connect with your community? And that's such a strength created by the diversity in our group. Okay, next slide. Okay, so our committees and work group overview. So I've talked in our grassroots slide about how we do targeted work. And one of the main ways we do that is through our committees and work groups. Okay, next slide.
Yeah, thank you so much, Yolanda. I hope, again, everybody sees that this is just how we work. This is how we roll. We strive for complete equal representation among self-advocates and healthcare professionals. And because, hopefully everyone just heard Yolanda's words, like the lived experience is everything. And then what the professionals bring to the table is those kind of ins and outs of healthcare, which are so completely complicated and confusing. And so together, that's the power. That's what we want to use to collaborate and to really make, real change in healthcare. So we do have a structure that we've put in place. And so we have a couple of committees that are going to support all of the work. And then eventually, right now we're going to start with one healthcare sector specific work group, but eventually we want to expand to others. So we are starting with the health system work group, which includes clinical care settings. So this work group, we hope clinicians, physicians, nurses, other care professionals who work every day in healthcare systems or who administer healthcare systems, together with self-advocates, because as Yolanda said, we've all experienced the healthcare system and we all know where the major failings are. And so that first work group is going to focus on how can we improve those clinical care settings to support people with IDD. So that emergency room example, that would be something that the health systems work group would work on. And that's not a made up example. That is a provider in Tennessee who worked to develop a sensory-friendly emergency room and expanded it to all of the hospitals in her healthcare system. Now we want to take that and bring it to our health systems work group and say, hey, is this something anybody else is interested in? Do you want to take that model to your health system and see if that's something that we can, roll out and learn from all of the lessons? And that's really where all the shared learning comes into play, because it's so hard to make change in healthcare. You have regulations, you have budgets, you have people who might be a little set in their ways. Again, Yolanda said it best, we don't finger point, we don't wag our fingers, but we also acknowledge that there's a reason why our health care system is the way it is. And so we want to think about what are those barriers to making it better? And do we have lessons learned from that Tennessee example of, how were they successful? How did they get that room set aside? Who did they talk to about regulations and budget and all of that non-glamorous stuff? And so that's what we want to take and use shared learning and the healthcare work groups to do that. We also want to wrap around our healthcare work groups. And again, right now we just have health systems, but eventually we want to have an insurance industry work group. Myself, I know my colleague is on the line, and several others who work in this area. We know there's tons of room for improvement. And so that might be next. There's also research and academia. We know that individuals with IDD are really underrepresented in clinical trials. And so we have members of the IDD Advocate Corps who that's their main job, is research or academia. And so, that's another area that we want to focus on. And clinical education, same thing, where we want to help teach the next level, the incoming group of clinicians who's next about, how to really manage and support people with IDD. So again, that's the vision. And then the committees that we have wrapping around to support those work groups we have a research and learning committee. And so what we're going to be doing there is to, again, do all those support that Yolanda was mentioning, advocacy toolkits, presentations, talking points. We want to see what all of the different what's out there and what we might need to develop to support all of the individual members of the IDD Advocate Corps, so that you can do what you want and need to do to be an effective advocate. The policy committee, where I'll talk a little bit more about each of these, the policy committee is going to handle things like when the U.S. Department of Health and Human Services releases a complete update to, the disabilities regulations and so forth. We want to, again, leverage that power of the lived experience, plus all the people in our group who have that policy world experience, and bring that together and write a comment letter to the to the Department of Health and Human Services and say, like, we're not just commenting on, policy at a high level or in an ivory tower. We are sharing our lived experiences, and this is how this potential change in the law is going to affect me. And so the policy committee, we've already done a couple of those, and they were really fantastic. And we'll do more as those come up. The communications and planning committee, we want to get the word out. Eventually, right now we're just kicking off, but eventually when we do build out these additional work groups and we get more funding, we want to spread the word, and be that on social media, or getting news articles written about us. We also are committed to developing a story bank. And personally, this is one of the things I'm so excited for this whole initiative, is to either record or written or whatever the format is, people's lived experiences of healthcare, whether they're bad, good, or what they want to see changed. And then we will use those stories, first of all, to support each other. But secondly, we can use them in our comment letters. We can use them in our advocacy. We can use them in our toolkits. And then we have a governance and membership committee, which is just going to manage kind of the whole thing. And then we are so excited to have a self-advocate commons, where, again, it gets to that nourishing community where self-advocates are just there for each other. And that's it. There's no agenda. It's really just there to support each other. Was there a question? Okay. All right, let's go to the next slide, because we're going to go through each one quickly. And then what I really wanted to do was, if the committee co-leads feel comfortable, if they're on the line and feel comfortable, come off video, give a wave, or put it in the chat, say hello, because I want everybody, again, to know that this is a community, this is a joint effort. And so, when you participate in any of these committees or meetings, it's not just, one or two people, it's a huge team effort. So again, this is the governance and membership committee. We will set the policies around membership and criteria and guidance. And so if any kind of sticky issues come up as we're rolling this out, because this is brand new, never been done before, we'll bring those to the governance committee. So you've got myself on that, Laura Coleman, Craig is on the line, Sue is on the line, and I believe Adam is on the line as well. So if any of you want to just give a wave so people can put faces with names, go ahead and do that. And again, I think everybody sort of introduced each other in the chat.
Hey, I'm Craig.
Hi, everyone. I'm Sue. Nice to meet you.
Hey, everybody, I'm Adam.
Okay, great. All right, let's go to the next one, because that one's probably the most boring. So this one is, I'm super excited about this one. This is the Research and Learning Committee. So again, our first goal is to take a look at what's out there, right? If there's advocacy training materials out there that are fantastic and we don't need to recreate the wheel, great. So we're going to look and see. But again, as Yolanda mentioned, there might be a lot of materials that are out there, but they may not be in plain language. So the Research and Learning Committee is going to be focused on how to support all of the IDD advocate members in advocating and communicating. So that could be trainings, it could be, again, toolkits. We also would like to have maybe like webinars where you know, each work group is going to kind of meet together just themselves. But wouldn't it be great if when we have multiple work groups for them to hear about what each other is doing and any successes or any challenges? So that's what we're going to facilitate as part of this research and learning committee. So Dodie, I see you're on. You want to give a wave?
Nice to meet everybody. Thank you for being here. This is so exciting.
Great. And do we have Erie? I'm not sure if Erie is on. They may be joining
Today, no.
Okay, they may join the next one. And do we have Becky?
Nope, it was just Jody today.
Okay, and then Monica is also. So they'll join the next call. But again, if you're interested in joining this committee, send us an email, and we're starting to build out our committee membership and our distribution lists. So let us know, and then you will be hearing from us about, you know, when our very first committee call will be kicking off. All right, let's go to the next one. Communications and planning. So Yolanda, if you want to say hello again.
Hello, it's me again. So you'll be working with me, the amazing Rachel, Nathaniel, Emily. We're always glad to have more people. So we're basically going to be providing communication support, assist with preparing talking points, plain language materials, and media resources for activities. We'll also be helping manage social media, messaging campaigns, newsletters, health story bank, fingers crossed. Also very excited for that because I really think the key to helping people realize how important healthcare is to the IDD community will kind of show both the triumphs and the shortfallings of healthcare and really humanize that struggle. Because I think it's very easy to zoom out on things and really miss the impact of it's having on individual lives. So very excited to do that work. So yeah, if anyone's interested, please join us. And if anybody else would like to say hi, who's on the call, feel free to go ahead.
And I was just going to say, and this is why Yolanda is co-lead of the communications committee, because she just speaks so eloquently. I love it. All right. Do we have anybody else on? If not, we'll keep going.
Yes. My name is Nathaniel Lantz, and I am honored and humbled to be here and to be part of the communications and planning committee. Thank you so much.
Ah, fantastic. I'm so glad you were able to join. Okay.
I was just going to introduce myself. I'm Emily Metzger. I'm the other co-lead. It's great to see everyone and meet you all.
Oh, perfect. Sorry, Emily. I didn't see you there.
All good. All good.
All right. So let's go to the next slide.
That's clean.
All right. So the policy committee, I explained that a little bit about developing and amplifying our policy platforms. So writing comment letters or policy statements. I see we have Howard on the line. Do we have Emily, Nicole, or Kim as well?
Yeah. Hi, everybody. Howard Haft, position. Really excited about working with the policy committee, and certainly we will welcome others who want to join. I think it's really important work to be kind of bi-directional and both look at policy that's coming down the pike that affects us, and also at the same time influence policy that might be formed in the future that will have effects. And looking forward to working with everybody.
Okay.
I think Emily is on the line.
Alexa, camera off.
I don't know if my camera is working or not, but I'm
You.
Emily Johnson. Also excited to be a part of the policy committee and looking forward to working with everyone.
Awesome. And then I do see a chat from Rachel saying, apologies, my internet isn't cooperating, so I couldn't introduce myself. Also on the communications committee and looking forward to working with you all. So thanks for that. Okay, so let's go to the next one. So this is the Self-Advocate Commons, and I do think we have a couple of the co-leads on the line. Again, this is a dedicated space just for self-advocates, and it's really meant to be a place of communicating, to share your experiences, your learnings, your observations from all of the other work, and just be there to support each other. So I think we have BJ and Lizzie on the line. Do you want to say hello if you're comfortable? If you're not, that's okay. You can put it in the chat too.
And Joe.
Hello, Lizzie Graham, pronoun she, her. Great to be here. Look forward to working with this wonderful team in the fall.
Oh, and I also said we have Joe. So Joe, if you want to say hello as well.
Hi, everyone. Great to be here. It is going to be awesome to hang out with a lot of self-advocates.
Hello, everyone. I'm BJ. Great to be here. IAC is an awesome group. Glad to be fostering comments from self-advocates. That's what matters most in this work we do. So glad to be here. Glad to be a part of it.
Absolutely. Okay. All right, so let's go to the next one, which is the last of our set of committees and work groups. So again, this is the first work group. We want to eventually get more funding and roll out additional work groups on those other healthcare sectors, but we're starting with the health systems work group. And so this is where the real work happens. This is where we want to do that shared learning, discuss what our vision for healthcare should look like, how we can co-design that healthcare system that just works better for everybody, and then how we can advocate. And again, all of the other committees are really meant to support the health systems work group with everything that we've just talked about. So do we have Carmen, Jennifer, Maggie, or Rose on the line?
This is Maggie. I'm on the line. I'm excited to work with everyone and move healthcare forward.
This is Jennifer Cachera. I'm here. Greatly looking forward to being with the group and all of you. So thank you.
I'm here too. It's Rose. I'm really excited to be here and just sharing something else. I'm in Maryland and I recently listened to a statewide meeting this week, and they also see this as a very important area of concern. And it was like a breath of fresh air to know, like, we're not the only ones. So I look forward to working with everybody.
Awesome. All right, so let's go to the last section of our presentation here, and then we want to make sure that if people have questions, I see there's a lot of questions happening in the chat, which is fantastic. But if anybody also wants to kind of come off mute and ask a couple of questions, we have time for that in just a bit. So again, as I mentioned, we want to start tackling the other healthcare sectors next. So these are some responses from everybody's interest surveys, but as we get on in time and in the work, we can always reevaluate. But education, nonprofits, policy and government, academia and research, thought leaders, healthcare journals, then the media, insurance, as I mentioned before, professional societies, and then entrepreneurs and investors, who we also have a bunch of members who are in that field and wear those hats. And that's also a really exciting place. So that's really what we want to keep our eye on the goal for going forward. But for the moment, we're rolling out with what we've got. All right, so let's go to the last section, which is next steps. Next slide. Okay, so now that you have heard about the committees and the work group, we really, again, you heard everybody kind of give a pitch like, hey, come join us. I did see a question in the chat. Can you join more than one? And the answer was perfect. Yes, as much as time allows for yourself. And we also always, again, want to make sure that we're balancing that each committee and each work group has that that equal representation of self-advocates and healthcare professionals. So we may, if we get tons and tons of interest in one committee, we may sort of see if we can balance it out. But we really want, again, this is driven by all of the participants who are on the line. This is driven by you. And so we want you to be in the committee or work group that you feel most comfortable and that you feel like you have the most to contribute. So this summer, we're going to kick off communications and planning, research and learning, and the health systems work group. But because we are grant funded and because we believe in compensating our self-advocates for the time that you take to participate, it means that we do have sort of not a limited, but certainly we have a budget that we have to work within. And so we are going to just, until we get more funding, we are going to then say we're going to stagger some of the kickoffs. So in the fall, we'll do the policy committee and the self-advocate commons. And I think the self-advocate commons, that might be a really good time to do it in the fall because we expect our self-advocates to be participating in the other committees. So it'll be a good kind of time to check in after maybe we've had a committee call or two to really see like, hey, how is this working? And is it going well for everybody? Is there a question?
What?
Okay, I see a hand up.
This is Janet Schaus. I just want to make sure I understand the Research and Learning Committee. That research and learning is aimed at enhancing self-advocates' skills, right? We're not talking about researching like healthcare barriers and that sort of thing, or are we?
It's not just for enhancing self-advocate skills. It's enhancing all of our skills to be able to effectively advocate on behalf of the IDD community. So for example, when we want to do advocacy training, we're going to do that for everybody, self-advocates and healthcare professionals. When we do toolkits, we want to make sure that everybody has the talking points or the statistics or the really powerful stories that we've been talking about. So that's really for everybody. So that's what we mean by that. And so part of that might mean the research, we're not talking about like original research, if that was your question. We're talking about seeing what's out there, looking to see, are there already great toolkits? Great, let's not reinvent the wheel. But, there might be times where we do need to develop our own sets of materials. And so that's really going to be within that research and learning committee.
Thank you.
Great. Any other questions about the committees and the work group? Okay, and I saw a question about what if we don't know what committee we would be best on? And so Lauren, who's on the IEC team, said we're happy to talk about that more and see what might be the best fit. I see another hand up. Matthew?
Yes, thank you. My question is, in the same topic, research and learning, which, and in the communication, is there a way to, like you said, not reinvent the wheel? Is there a way to network and collaborate, in a way where it's more efficient, with me, I could sit there and say I could join all of them because that's what I'm doing in my state right here, about 20 plus committees I'm on, which takes my day. It's not like I said, it's not, it is what it is, unfortunately. But to me, it's like, what, and that question brings up a point, and is these committees, once it's done, the outlook, will there be a chance for career involvement? So if people want to take this to go career, other credit courses for them to apply to. This might be like, something like you said, research and learning. I want to learn all of this moving forward. Is there college credits or certain credit for individuals so they can actually, if they want to go career, they have this, to help them to go to career in a medical profession field, and making sure that, they have all the information they need to, not only to be their authentic self, but also help others, in a more meaningful, and productive way and more efficient way. But yeah, my question is to, how can we network together, collaboration? So like you said, we're not reinventing the wheel here, but in a way where all of it comes together and with a true focus of making sure that all the pieces, work together as a well-oiled engine. Thank you.
Yeah, no, that's a great question. And so that's a little bit of what I was saying about how we want to maybe get everybody together once a quarter and share what's happening in each of our different committees. The governance committee is also another place where we will kind of look and see across all of the different committees what's happening or issues, or maybe there's an issue that's coming up that people are facing a big challenge in multiple ways. And so let's collaborate, let's brainstorm together about, how we can do that. So, and then the question about the credits, I mean, that's, I don't think that's in the scope of this initiative. There might be other things that are out there, but we're really just trying to kind of get together, learn, like you said, learn everything we can, and then be powerful advocates within policy, within, our day jobs, basically. So, but we can, I'll maybe ask the IEC team to weigh in over chat if we.
Yeah, that one more important question, and this is a big one of them all. Where do you see equity and equality fit into this, moving forward? Because that's a big issue across the country about equity, because we got a lot of, marginalized communities out there that feel like, being left behind. Thank you.
100%. And we could not agree with that more. It is, I mean, frankly, the entire IDD community is marginalized. And then within that, there is additional marginalization with people of color and sexual orientation and gender identity and everything. So again, Yolanda said this really well before about the diversity of our group. And so if we are diverse ourselves, we can build those perspectives into everything that we do. Oh, Mai, I see you got your hand raised. So Mai is our fearless leader.
I'm so not. I'm totally a follower on this initiative. Elyse is not telling the truth. But Matthew, let me just offer these thoughts in response to your question. As Elyse says, it's not within our scope to really, offer any certifications or degrees for the work that the Advocate Corps does. But what we do hope will happen is that one, community members will learn about healthcare and to gain experience interacting with professionals in healthcare. And three, part of the networking that we hope you engage in is with people who are not like you. And you never know where those kinds of connections can lead in terms of future opportunities. So we obviously can't promise anything, but that was always a part of the vision, that, you know, being a part of the core would help enrich everyone's lives in ways that we can't predict.
Love that. All right, well, in the last 3 minutes, we're going to wrap up with our last slide, which is what to expect next. So there's some technical stuff here. We are, when we do all the sharing and networking and materials, we've got to have a place to put it. So we are using a Google Drive, and what we're going to do is have everybody get an invitation via email to access the Google Drive. So be on the lookout for it. If you don't get it, let us know, because maybe it went to spam, or maybe we had your email wrong or something. So that's really important, because that Google Drive is going to be the place where we have all of the resources and all of the meeting minutes and transcripts and all that fun stuff. We also, again, believe that everybody has different learning styles. So we have lots of tutorials and resources as well. So once again, you get onto that Google Drive and our Google site, there's going to be like little tutorials on how to navigate in Google, how to do Zoom, etc. This is really important for the self-advocates and their paid partners. Again, as I mentioned, we are a huge believer in compensating self-advocates for their time. And so we have very detailed process and payment policies. So there's a video right now on the Google site, and I believe Madeline also sent it out to everybody in advance too, that lists out what you can, code your time for, what's okay, what's not, and then how to submit your time so that we know what to pay, and then what forms we need, and all of that stuff. That does not apply to the healthcare professionals. We are all volunteers, so we don't have to worry about that piece. But for the self-advocates and their partners, it's really important. And then next, for each of the committees, we're going to have a charter, because we believe in action, not just talk, but action. And so the charters are really going to lay out what are those goals and those action items that that each committee and work group is going to do. If you have questions, we are holding optional office hours. So you don't have to come to these. If you listen to the videos and you're A-okay, don't worry about it. But if you do have questions, either email us or come to one of these June office hours, and we'll help you work through any of that technical stuff. And then again, we need those forms for the paid partners, our self-advocates and their partners. And that's it. So thank you so much again. So again, this is your checklist. You can use this to check off. Email us the groups you want to join. Look for that email with access to the Google Drive. Fill out the forms. If you need to, if you are one of the people who is going to get paid, review that video and expect updates from all the leaders who came up. All right, well, we want to be sensitive to time. So again, don't hesitate to reach out if you have questions, if you want to think about everything and get back to us, or join those office hours. We are so thrilled to kick this off, and we are just excited to work with everybody. All right, we'll go home today.
Thanks so much for your time, everyone. Take care.